and so you have less air in there and it comes into the syringe easier.
It also fills, it replaces what you're taking out fluid-wise. Does that make sense? So you want to put that air in there. Okay.
Alright. And then there's an intramuscular, which is IM, and the easiest spot to give it is right under the armpit. So if you kind of go behind their elbow and you can feel a big muscle right there, what you want to do is stick the needle in there, pull back to see if there's any blood, and if there is, then try again, so that way there's not. And if there isn't, then you can go ahead and give the injection. Another site for...
You grab right here.
Right, if you go right by the elbow, that's how I always do it, slide under the elbow and pull up, then you get that nice muscle right there.
You can grab and feel the muscle.
Yeah.
Can you feel it? Yeah, you can just... Alright.
And then another spot is the muscle in the hind leg, except that one you have to be careful with because
you can hit the sciatic nerve.
The second most common type is the sub-Q, which is just right under the skin. So what you do again by the armpit, because it usually has like the most extra skin and everything, you just pull up the hair a little bit so a little bit of skin's under there. Put your finger like right on the tip of the tent and slide in the needle until you can feel it right under your finger. Make sure you don't poke through or anything, and then you inject it in there. And that's it.
And then if all you guys that have 4-H leaders, okay, make sure you get this down with your 4-H leaders, or find someone to make sure you learn this with, because you cannot afford to keep asking the vet to come out to give shots. It just gets awful.
$60 a shot.
You just can't. Okay.
If anybody needs practice, we're going to be, probably 2 weeks from today, we're going to be doing a bunch.
Okay. And pretty much all the leaders in our group, doesn't matter what group you're in, they'll take you, you know, and teach you.